Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. If you play contact sports, you're probably familiar with the concept of a stinger, also known as a burner. A stinger is a shock a person feels along their arm when they incur some severe nerve damage. Usually stingers only last a few seconds and the athlete quickly resumes play. However, people who suffer stingers are at a greater risk of getting worse ones in the future, and neck injuries may result in additional damage that's not immediately apparent. So as providers of non-surgical therapy for sports injuries, we chiropractors are well suited to assist athletes recovering from neck and shoulder trauma, but we want our patients to understand why they should have their injuries examined and looked at and what can be done to help them. The nerves leading to the arms emerge from the spinal cord and the back of the neck, and they bundle together in the shoulder to form a structure called the brachial plexus before they divide again and continue into the arm and the hand. A stinger can result from the nerves being stretched when a person's head is pushed too far backward or to the side, or from a direct blow to the brachial plexus. Injuries to the neck resulting in ruptured spinal discs, joint displacements, or swollen tissues can also put pressure on the nerve roots. Stingers get their name from the electric discharge triggered by the injury. After experiencing a burst of pain down their arm, a patient may find that they have difficulty moving it. They may also experience a prolonged burning sensation and try to shake the feeling of pins and needles out of their arm or hold it close to their body. Although damage to the nerves is not usually permanent, it may be recurring despite the initial shock only lasting a few seconds or minutes. Most stingers occur in football players, although they're not uncommon in rugby, lacrosse, and hockey players, wrestlers, and gymnasts too. They can also happen to people during motor vehicle crashes or people who fall off horses. Some people are at a greater risk for stingers due to having naturally narrow spinal canals. Stingers can also occur due to the shoulder being pushed down too far, so a person may be at a greater risk if they have not built up their shoulder muscles or if they have been weakened by a previous injury. So for this reason, people who have suffered a stinger-inducing blow are likely to suffer a second one that will be worse if they don't take time to recover. Athletes should not return to play while they're experiencing pain or difficulty moving with this. In the immediate aftermath of a stinger, they should employ rest, ice, compression, and elevation, or the RICE protocol. Afterward, they should be examined for potential fractures or spinal cord injuries. Image tests and physical exams can also be done when a patient like this is in severe pain or has recurring injuries. Also, sometimes physical therapy is recommended for improving the neck and shoulder flexibility as well as the shoulder strength. Also, as a chiropractor, I typically also can advise patients in postures that'll put less pressure on the nerve roots in their necks and perform adjustments when there's reason to suspect a compression. Chiropractic offices, including mine, provide ultrasound electric muscle stimulation too. And these are drug-free and they're anti-inflammatory. And athletes who have recurring injuries can be advised to play while wearing specialized padding too, but most people fully recover in a short period of time. So to reduce the risk of stingers in the future, athletes should work to ensure that their neck and shoulder muscles stay strong and that their necks and heads are adequately protected. If you know somebody like that, send them to our office at newhopechiropractic.com. We'll be happy to help them. And you can also access our site for more information. And that's, once again, newhopechiropractic.com. And have a healthy day.